What are some of the reactive and proactive MSL activities? On a day-to-day basis, MSLs do a variety of things, and they can either be reactive or they can be proactive. In a job description, you might see either reactive or proactive, and you might even be asked in a job interview about reactive or proactive MSL activities. That's why it's really important to understand what these key activities are. Let's dive into them. An MSL is primarily in a reactive mode. This is about 80 to 100% of the time, depending on the job you do. Some of the activities that an MSL does that are reactive are centered around the listening priorities. Listening priorities are something that a medical affairs leader or medical director sets as a key set of listening things that you're supposed to be doing while you're having a conversation with an HCP. The listening priorities can be a variety of things. They can be about safety, efficacy, or even mechanism of action. As you're having a conversation with an HCP, what are some of the things that you're going to be doing is you're going to be reactively listening, so then you could gather insights based on what they're saying based on your listening priorities. As you're gathering these insights, you're then going to bring back the insights based on your listening priorities back to the company, which at that point you could potentially answer survey questions. Companies might have internal survey questions. They are reactive, and they are typically around in conversation that you had with the HCP based on the knowledge that you learned. So it is reactive. You're not going to go proactively ask these questions to an HCP. It's just based on the conversation and what you learned. Each company is different, so they might either have these internal survey questions or they might not. Where the MSL will primarily spend most of their time is answering unsolicited requests. These can come from 3 different platforms. You can get them from commercial. Oftentimes when a sales rep is out having a conversation with an HCP, they might be asked a question that is considered off-label. At that point, the MSL cannot go in there unless a MRF is put in. A MRF is a medical information request form, or a MRF. So the commercial representative will then fill out the MRF, and then the MSL can then go talk to the HCP based on the request and the information that is requested from the HCP. The second thing an MSL do will be unsolicited, will be around what and how they interact with their HCPs. When an MSL is interacting with their own HCPs, the HCP might say something along the lines of, "I would like to be updated every single time you have a new Congress or data release." So that is the cue for the MSL to then reactively, after every single Congress that you have new data, to then go back to the HCP and update them based on their request, which was unsolicited, and this is therefore reactive. The final way an MSL could be potentially reactive is if a HCP puts in a MRF all on their own. This might be an HCP that just has a question and they don't know the MSL in the area, so they might just put it in a MRF, and then the MSL can then go respond to the HCP based on the information that is provided in the request. Some of the proactive MSL activities that you could potentially do depend on the company. These are highly regulated processes. In each pharmaceutical company, you have a review committee. This consists of legal, regulatory, and medical, and sometimes even compliance. They monitor exactly what an MSL does externally, especially when it's proactive, because MSLs, they are not proactive. They are typically reactive, and you don't want to assume or be assumed as though you are promotional. So that's why proactive activities are highly regulated for pharmaceutical companies, but they do happen. So let's talk about some of the activities that you could do. As an MSL, you could potentially give a presentation around a certain topic. This could include AR management, guideline education, or even disease state education. These activities are typically followed by a PowerPoint presentation, and then you don't have questions afterward, and then you end that activity based on the presentation and the guidelines that were provided. Another thing you could do that is proactive as an MSL is you could potentially talk about a phase 3 clinical trial that was recently published in a manuscript. This, again, would then be another proactive presentation that you would go talk to an HCP about based on their request, or you could even proactively ask them if they would like to gather or have this information that they would like to be presented to. Another thing an MSL can do is typically when you have pivotal phase 3 clinical data, a medical director or a medical affairs leader might want to have specific questions that the MSL goes out and asks the HCP based on the data that was presented. This can be around safety, efficacy, or mechanism of action. It will typically be a very targeted question that you could proactively go ask the HCP, such as, what are your thoughts on the recent data that was presented at X Congress, and what do you think about the efficacy? Another thing an MSL can do that is proactive is even around a clinical trial. So when you have a clinical trial, either data readout or approval, that's a time when an MSL could potentially send an email proactively to go tell or let the HCP know that either the data was presented or the product was recently approved. These are just some of the MSL proactive activities that an MSL could do, and even in some companies, MSLs are never even proactive. So it just depends on the certain company and what their proactive rules and regulations are. These are just some of the activities that an MSL can do that are either proactive or reactive. Remember, each pharmaceutical company is different, and so the rules and regulations will be different for every single MSL and every single role. So understanding these and being able to talk about them in the job and even in the job interview is going to be extremely important for you. Follow me for more information at CaseyEstinson.com.